Hello, I am Dr. Sujoy Dasgupta, consultant gynecologist and infertility and IVF specialist. Last week, a man came to our clinic with azoospermia, that is no sperm in the semen. We said that if we do TESA, that is if we collect sperms from your testicles, there is good chance that you become biological father. But before doing TESA, you need to do one special test for cystic fibrosis called CFTR. The men were wondering, doctor, it's a very expensive test. Why you are advising this test to be? Then I started him explaining what is cystic fibrosis. Remember, cystic fibrosis is a genetic disease and it can be a lethal disease. It can affect the baby. Baby can have problem in breathing from birth. They can have repeated episodes of respiratory tract infection, that is pneumonia, since birth. They can have diabetes from early age, and they can have problem in digestion, and unfortunately they can die very soon after birth, within very few years of birth. Cystic fibrosis is a genetic disease. Is very common in Caucasian, in European population. In India, it's not very common. Still, it can happen in babies living in India, Pakistan, or Bangladesh. Even we got some couples coming to our clinic saying that their previous baby has died unfortunately because of cystic fibrosis. Therefore, we have to take care of it. Now, you can argue, nobody in my family is having cystic fibrosis. How come my baby will be affected with cystic fibrosis? Remember, if you or your family members are carriers of cystic fibrosis, that is, if only one gene is affected with cystic fibrosis, you will not have any problem with cystic fibrosis. You are just carrier, just like thalassemia carrier. We don't know that you are carrier. But if both the parents, both the mother and father are carriers, in that case, baby may be affected with cystic fibrosis. Therefore, we need to take care of the baby. That's why we are advising this cystic fibrosis testing. Now, what's the relationship with cystic fibrosis in azoospermia? Remember, all cases of azoospermia, cystic fibrosis testing is not required. In certain cases, the test is required. That is obstructive azoospermia. That is when there is obstruction to the semen conducting path, but testicles are producing sperms in good amount because of congenital bilateral absence of vas deferens. That is, what is vas deferens? There are two pipes which are carrying sperms from the testicles to the prostate. If these two ducts are not there, this is called congenital bilateral absence of vas deferens. And it can cause obstructive azoospermia. That is, sperms are there inside the testicles, but sperms cannot come out because of obstruction. And one of the most common reasons for this congenital bilateral absence of vas deferens is cystic fibrosis. Therefore, in that case, we need to check whether you are carrier of cystic fibrosis. Now, how we can suspect your bilateral absence of vas deferens? It cannot be diagnosed by ultrasound. You need to go to doctor's chamber for physical examination. Doctor will check your testicles and see whether vas deferences are there or not. Sometimes it can be suspected by doing transrectal ultrasound, that is, doing the ultrasound by inserting ultrasound probe in your rectum, and sometimes by semen analysis, because sometimes semen analysis in azoospermia may show low pH and low volume. In that case, we can suspect that you can be carrier of cystic fibrosis. Therefore, you need to do this CFTR testing. Now, if your CFTR testing is negative, that is, if you are not carrier of cystic fibrosis, you don't need to worry about cystic fibrosis in the baby. That is, your baby will not be affected with cystic fibrosis. But if you are carrier of cystic fibrosis, you need to check the CFTR testing of your partner, that is your wife. If your wife is not carrier, but only you are carrier, then again, at the maximum, your baby will be carrier of cystic fibrosis. That is, baby will not be having cystic fibrosis. But if both husband and wife both are carriers of cystic fibrosis, in that case, there is 25% chance that baby may be affected with cystic fibrosis. That is, out of 4 babies in you, 1 can have cystic fibrosis. We don't want your baby to be affected with cystic fibrosis because you are doing IVF, you are spending lots of money. So we don't want your baby to be affected with lethal disease. That's why you need to take care of this disease. But if both your husband and wife both are carriers of cystic fibrosis, even in that case, we can do IVF using your own egg and own sperms. But in that case, we have to take special precaution called PGT, pre-implantation genetic testing. just to make sure that your baby will not be affected with cystic fibrosis. Therefore, if you are having obstructive azoospermia because of absent vas deferens, it's important to do CFTR testing. Thank you for watching this video. If you have any further queries, please don't hesitate to contact us through our Facebook page or YouTube channel. Thank you.